Hello friends, I am Dr. Anjuja, Assistant Professor, Government Nagarjun Postgraduate Science College, Raipur. Here I am going to discuss local anti-infective drugs. This is the second video, and this part is local anti-infective drug is a part of MSc 4th semester, paper 2, Medicinal Chemistry, Unit 3, part A. Antimicrobial drugs. Antimicrobial drugs may be classified into two categories, namely first line drug and second line drugs. First line drug is the isoniazid drug, ethambutol and streptomycin. First line drugs used widely for tuberculosis. First drug is ethambutol. Ethambutol is synthesized by the resolution of 2-aminobutanol with D-tartaric acid to form 2-aminobutanol, and 2-aminobutanol first treated with 1,2-dichloroethene and second treated with hydrochloric acid to form ethane-butanol hydrochloride. Ethane-butanol hydrochloride may be used alone to clear the sputum of mycobacteria within a span of 12 weeks in many cases, but bacterial resistance usually takes place in 35% of cases and thus leading to frequent relapses. Therefore, it is employed in combination with isoniazid, pyrazinamide, cycloserine or ethanamide. Such relapses are unknown. Second drugs are ethanamide. Ethanamide found in ethanamide in Ben and USN. It is also synthesized by the dehydration of 2-ethyl isonicotinamide to form nitrile derivative. Nitrile derivative is treated with triethanolamine to form ethanamide. It is used only when the usual combination of PS, streptomycin and INH are either intolerable or ineffective. Isoniazid. Isoniazid is a first-line antimicrobacterial drug. It is also synthesized by the oxidation of 4-methylpyridine to form isonicotinic acid. Isonicotinic acid is treated with anhydrous hydrazine to form isoniazid. Isoniazid is considered to be the drug of choice for the treatment of tuberculosis. It has also been employed as a prophylactic for those who were constantly exposed to tubercular patient. 4-aminosalicylic acid. 4-aminosalicylic acid is also known as para-aminosalicylic acid and sold under the brand name Tasser. It is synthesized by the nitration of 2-aminobenzoic acid to form 2-amino-4-nitrobenzoic acid. 2-amino-4-nitrobenzoic acid undergo diazotization to form diazosyl chloride compound. This compound undergo hydrolysis in the presence of hydrochloric acid. 1 mole of nitrogen is liberated and para-nitrosalicylic acid is formed. Para-nitrosalicylic acid undergo reduction to form 4-aminosalicylic acid. It is especially used to treat anti-tuberculosis medication. Chloroquine. This drug is an anti-malarial drug. It is synthesized in 4 steps. First step A, preparation of 4,7-dichlorophenolene, that is nucleus. Second step, preparation of 2-amino-5-diethylamminopentane. Step C, condensation of A and B. Step D, addition of concentrated phosphoric acid to a hot ethanolic solution of the condensed product. Step A, preparation of nucleus. When metachloroaniline is treated with formic acid, 1 mole of water is liberated and an aminoaldehyde is formed. An aminoaldehyde is treated with chloroaniline. Again 1 mole of water is liberated and amide is formed. Amide is treated with ethyl malonate at 100 degrees centigrade to form a diester. This diester undergoes cyclization and also condensed to form ethyl ester of 7-chloro-4-hydroxyphenolene 3-carboxylic acid. This compound is undergo hydrolysis. In this step, 1 mole of ethyl alcohol and 1 mole of CO2 is liberated and forms 7-chloro-4-hydroxyphenolene. This compound treated with phosphorus oxide trichloride or thionyl chloride to form 4,7-dichloroquinoline. Step B, preparation of cyclone. When ethylene oxide and diethylamine is treated in the presence of methyl alcohol to form 2-hydroxy diethylamine, and this compound is also prepared by the treatment of or reaction of 1-chloro 2-hydroxyethane with diethylamine to form again 2-hydroxy triethylamine. This compound is treated with thionyl chloride to form 2-chloro-triethylamine, and 2-chloro-triethylamine is treated with ethyl acetate in the presence of sodium ethoxide. 1 mole of HCl is liberated and intermediate compound is formed. This intermediate compound undergo hydrolysis. 1 mole of ethyl alcohol and 1 mole of CO2 is liberated and form 1-acetyl 3-diethylamino-propane. This compound undergo oxidation and reduction with non-chemical to form 4-amino 1-diethylamino-pentane. And step C, when 4,7-dichloroquinoline condensed with 4-amino 1-diethylamino-pentane to form chloroquine base. Chloroquine base is treated with 1 mole of hot phosphoric acid in ethanolic medium to form chloroquine phosphate. Chloroquine is an anti-malarial drug. These drugs are found to be active against the erythrocytic form of most malarial parasites, ultimately affecting a clinical cure. It is extensively employed for the suppression and treatment of malaria. The overall activity of chloroquine appears to be partially dependent on the preferential accumulation in the infected erythrocytes. It has been observed that it especially kills the erythrocytic forms of all malaria parasites at all states of development, but has no effect on malaria parasite in the human liver cell. Hence, chloroquine produces complete cure of malaria caused by parasite falciparum. Thank you.